Well, it's time to start. Let's get started. So I'm Yukari Tsuji, the chairman of this keynote session. So I'm very pleased to welcome two distinguished researchers, Dr. Kawahara and Dr. Arakawa in this keynote session. So as first presenter is Dr. Kawahara. I'd like to introduce Dr. Kawahara. Dr. Kawahara is a professor in the School of Engineering at the University of Tokyo. He specializes in ubiquitous computing systems. In 2022, he developed MoCA. Okay. On-campus contact notification application, and is leading its operation on campus. This talk will discuss how mobile sensing is implemented worldwide for contact tracking and its use in society. So, Dr. Kawahara, could you start your presentation, please?
Thank you very much for introduction. I'm Yoshihiro Kawahara from University of Tokyo, and today my talk is titled "Did Contact Tracing Work?" and subtitle is "Mobile Sensing and Social Design." So to start with my presentation, I want to ask, have any of you installed a contact tracing app, typically in Cocoa in Japan? Okay, okay, it's kind of surprising. I expected almost 100%, but not quite 100%. And so has anybody received notification through Cocoa? Oh, just one, two. Okay, thank you very much. Yes, so this is reality, actually. And but I used a very sensational title, but I don't have intention to make a binary judgment whether this was actually success or failure. And this is more about, I want to focus more on about the governance and also the design of the society and the design of the app. And also I would like to emphasize that engineers and researchers should understand the society and pay attention to the design of the society from now on. This is my key message. So the agenda is like this. First, I want to start with the transmission mechanism of new coronavirus and also the role of the contact tracing systems. The next, I want to introduce the status of the responses in each country. And then I want to introduce the MoCA, which is a contact tracing and a notification app used in the university. And finally, I want to conclude with by introducing some challenges and conclusions. So I think the most of the audience are already familiar and understand the mechanism of the coronavirus transmission. And COVID-19 is known to be very difficult to control because there is a large time lag of up to 14 days from the contact from an infected person to the onset of the illness. And also, onset of the illness is typically 5 days after the contact. So there's a time lag. And to make matters worse, the many viruses are released from 3 days before the onset of the symptoms, such as a fever. So this patient does not know she's actually emitting a lot of viruses from her. And also, it is also known that some infected people may not show any severe symptoms such as fever or cough, and they may spread the virus without realizing she actually carries the virus. And so various modeling and simulation studies have been actively conducted to make the precise prediction and the decision about the COVID-19 spreading among people and what can be done to stop spreading. And probably you already have heard about this. In the field of the public health, SIR model has been used since the 18th century to describe the whole transmission phenomenon using the ordinal differential equations like this. And the people who are susceptible is described as S, who have the potential to become the be infected is called S. And then those who are actually infected and may pass it on to the others are labeled as infected, and it's labeled as I. And then most people are recovered, or some people unfortunately dies after the infection, and this status is labeled as R. And there's a relationship between these variables time by using the ordinary differential equations. And although there are several problems with this model, such as it's enabled to reflect the effects of the p-host behavior change. So, but this equation assumes they are constant for this kind of coefficient. And but it can be it is relatively easier to understand the whole model, and also it is very easy to solve this kind of equations mathematically. So it can be applied to a wide range of diseases, including COVID-19. And what we can learn from these equations, actually, these two parameters will be the key to stop the spreading the virus. As this model indicates, this factor, beta, is related to how to reduce the risk of spreading. And also, this, as you see that this gamma, this is related to the quarantine. It is effective to quarantine the infected persons from the society. Yeah, and the government actually responded based on this way of thinking. So in Japan, at first, the government defined 3 dense situations. It's called for the actions to avoid this high-risk situation from the early stage of the diseases. It's left-hand side. And so avoiding dense area, also the wearing mask and doing nice ventilation is also the used as an effective countermeasure for stop spreading. And in addition, government also defined close contacts. In Japanese, 濃厚接触者. And this definition is a person in contact with, in close contact. Definition of close contact includes having in contact with an infected person at a distance of 1 meter for at least 15 minutes without a mask. So I'm not wearing a mask, but I am away from you more than 1 meter, so that nobody in this room is considered as a 濃厚接触者 in Japanese definition. And this concept also worked for a while, and because it was effectively used to identify and examine and quarantine only necessary people. And also, but it was very time-consuming task to find the people who is actually considered close contacts. So government next tried to think how to automate or screen, do automatic screening of a close contact. And many people found that managing the behavior of the infected virus was an important and effective way to control the infection in society. And also many governments also quickly realized that they could do this by utilizing the mobile devices, because almost all people are carrying mobile phone right now. So it is technically possible to use mobile tools to record the behavior and assess risk, but it's more like a people and the government's decision how to use this information. And there are 2 possible candidates, possible way to use this information. The first one is just recommend testing to the people because you have high risk of being infected these 2 days. So why don't you take a rapid test, for example? And the second choice is use allow and restrict activities based on this information. And the choice is heavily dependent on the culture and also political situation in each country. And China is a typical example of the latter. They first provided this kind of digital certificates through the web and also a smartphone app. And considering the locations and the medical information and also identity information, this system indicates the risk on a 3-point scale with the green, yellow, or red. And this color changes depending on the a lot of situations and a lot of variables. And most people must undergo PCR testing on a regular basis, like 1 or 2 weeks interval. And also, if someone traveled from the very high risk area, they are not allowed to enter some specific area or even buildings. And so people who is necessary to use this smartphone app need to care about how to maintain green all the time. So, but this kind of approach was very rare internationally. And so, in terms of technical, how to measure the assessment risk, how to measure the risk, and how to measure the distances between the people in the society. There are several ways to use mobile sensing to obtain such kind of location information. And the accuracy of measurements and also the risk of privacy leaks vary greatly depending on the choice of underlying technologies. And for example, cell phone tower can give a rough estimate, and the mobile carriers can tell how many people are within the range of 500 meters or so. But this is from the privacy perspective, this is safe, but it doesn't give any useful information whether some person is in close contact with somebody in 1 meter or not. So it cannot be used for such kind of detecting a close contact people. And the other extreme is to let people bring and BLE, Bluetooth Low Energy Tag, such as iBeacon, and use infrastructure or somebody else's mobile phone to detect track this kind of beacon. And yes. And Singapore was actually the first country to adopt this method. And each person has a unique ID and radiated from the smartphone, either smartphone or physical token. And the government distributed this free token to those who doesn't carry the mobile phone. And the radio signal IDs, unique ID emitted from these devices are captured by somebody else's smartphone. And this data was transmitted to the central server government is managing. And so the drawback of this approach is actually all the information is stored on the central server, which is in effect under the control of the government. So people some people hesitate to follow this kind of instructions. In Singapore, first, government promised not to use this information for other purposes other than the tracking the corona-related contact tracing. But there was news that some local police tried to access to this information to find the criminals. So there's a huge discussion how to treat this kind of sensitive information. And actually, to solve this problem, exposure notification API are proposed by Google and Apple. And I want to dig deeper about this issue. First, Pan-European Privacy Preserving Proximity Tracing Group first proposed protocol called PPPT. And this approach basically requires, proposed the realization of a contact tracing app that can be applied to the worldwide and in a standard manner. And in this group, first, they proposed instead of collecting local data, the infected person's device sends the data to a central server, like the ones used in Singapore. And then the central server processes the data and sends the alert to the target. And this is very scalable and also easy to manage. So first, it is natural from the engineering perspective to propose this method. But another group named DP3T pointed out that this kind of central approach should be avoided for the privacy concerns. So this group was actually from the Switzerland, and they proposed contact information with other people should be stored to the individual smartphone rather than the central server, and only alerts should be sent to the central server. And exposure notification API upon Google actually followed the second approach. And now all the information use exposure notification application data obtained from EN API is stored in each user's terminal right now. And this is how it works. Maybe the characters are too small to read, but basically EN API allows smartphones to transmit the weak radio waves to each other. And the difference is they use temporal random ID. For example, ID stays for some short time of the period, like 15 minutes or 60 minutes. And then this ID is mechanically generated. As I said, it's a random number. And this random number is not linked to any information other than EN API. So nobody can tell who was using this ID by using other source of information, other kind of information. And also, surrounding smartphones store the IDs transmitted by EN API if they are determined to meet certain criteria for the distance contact time. For example, 1 meter, 15 minutes. And so list of the contact is then created in each smartphone. If somebody gets infected in the coronavirus and became positive officially, they will be given some access token that proves this person is actually infected with coronavirus. And then by sending the by using this smartphone app, they can send the random numbers or secret key to the server. Then anybody can access to the server, but they only see the list of keys. And then all the smartphone regularly access to the server and checks if the uploaded key matches with their local entries. And this is how you can tell you actually get contact with the person without leaking any privacy. And so Cocoa is a Japanese version of the app developed based on EN API. And as of December 2020, this year, today, number of downloads was 41 million. And So roughly 30% penetration rate is roughly 30% of the population. And positive case registers was actually only 3.6 million. And total number of patients who actually got COVID-19 is said 24 million. And I think the real number is more than that. And what you can tell from this chart is the ratio of the system actually got the registration of I became a COVID-19 was only 15% of all the people who was actually infected due to COVID-19. So actually 30% of people actually using the smartphone, but only 15% reported actively used this main function of the smartphone app. So it was very tough to make people understand the benefit of this smartphone app. And this situation is not only limited to Japan, but the Western countries like US and European countries also have a difficulty raising the penetration rate of this kind of smartphone app. But on the other hand, Singapore has in the Singapore, it is reported 92% of the population were using this smartphone app at the June of 2020. So it's in the very beginning of the COVID-19, the 90% of the population actually used this smartphone app. So this is a huge gap between the government, depending on the political style and of each country. And yeah. And also, people found the challenge of contact tracing app was actually you need to care about the relationship between the public health versus privacy concern. Also, it is very hard to make people understand the merit of using this situation, this smartphone app, because it only works, only some emergency happened. And also, people's trust is related to the penetration rate of this kind of smartphone app. And from technical side, it was also very hard to debug because it's a fully decentralized application, and it is very hard to test the distance between the people and because you cannot tell the right answer to evaluate the whole system. And so it was very difficult for the Japanese government to deploy this kind of application. But University of Tokyo also tried to do something to bring more people back to the back on campus. And so this is a timeline of the countermeasures for the COVID-19 in University of Tokyo. U Tokyo has decided that all lectures should be done online in April 2020, and we made very fast decision. But from the September of the same year, 6 months after the spreading, some part of the lectures, such as physical exercise, were held on campus. And from 2021, the number of face-to-face lectures were increased. And now, in principle, all lectures are held in person on campus. And now campus is filled with a lot of students. And but the university faced the most difficult challenges when they start to resume face-to-face activity even before the vaccine appeared. So nobody knows what happens if the pandemic happened within a campus. So we invested on the some technology to enhance better ventilation. Also, we also invested to the idea to manage headcounts on campus. And so actually the MOCA was one of the solutions to manage headcount on campus. So that from technical viewpoint, this is based on the technology on which is developed almost 10 or 15 years ago in ubiquitous computing area. We basically choose to install BLE beacon to each room and use the student's smartphone to capture the beacon radiated from the beacon installed on the classroom. And the one I will show you why we chose this approach. And so this is actually the snapshot of the real website and explaining the functions of the MOCA. And here is how it works. The smartphone detects a beacon in the classroom, and this data is sent to the central server managed by university. And then this server, the information is actively not just only used for the contact tracing, but also used for the provide useful information. For example, is cafeteria crowded right now, or when is right time to visit cafeteria, for example. And also by getting the explicit permission from the user, it can also give the presence information like who is in the office today, because after became a free online activity, you cannot tell who is actually on campus, but you want to meet friends on campus. So if smartphone can provide such kind of useful information, or he's there, then each student can make decision. Okay, now I should also go on campus and discuss about the research team, for example. And so the key of realizing this function was a privacy policy, and also privacy policies. Each time the information is recorded, that this information is processed according to the predefined rule, which is agreed by the users. And if some user is, for example, allow for their data to be used for give the anonymous statistic information, so this data is treated for that. And if the user simply rejects providing data for even anonymous data, it's also allowed. It's also treated as such. And we believe that the key to this approach to be trusted is involve many people. So MOCA was actually developed by a student together with students, and in the pursuing what is ID labs that should be used on campus. And students from the Faculty of Engineering and the Faculty of Informatics assisted in the development, but those who cannot contribute in the development also helped install the beacon, for example. And also students from the Faculty of Law also made a major contribution in the development of the terms of use and also privacy policy from the professional point of view. And so this project just started in the June of 2020, and we used 3 months before recruiting students. And in the beginning of September, we developed the smartphone app, also deployed many sensors, beacons on campus. And beta test began on the October of the 2020. And after the start of the service of the MOCA, this is a usage statistics. each year, more than 6,000 users are registered for the MOCA. And about 1,600 beacons are deployed all over campus. And mainly it is deployed in the lecture room, but also it is also deployed in the professors, each professor's research group, laboratories, and so on. And also we, so here is a statistic. And so after the university decided to do more lectures on campus, we had more number of registered people, as you see in this graph. And in COCOA, there was little sense that application was being used, but so MOCA, we used consent from user and tried to provide many useful data. In addition, when there was an infected person in the classroom, even if it is not defined in the close contact legally, university provided an additional opportunity to testing for free. And this was actually helped students that they were relieved to be noted by MOCA, and they can take advantage of free testing, and they can safely feel safe for attending the lectures. So I'm almost concluding my talk, and based on my experience, I think MOCA was the social design experience, nothing but the social design experience. There's a huge debate between the privacy and the value the smartphone app can provide, and the students are actually involved in the decision making of this app. And we found that the people will not use some technology simply because it is technically safe, technically perfect, but it's more straightforward. I mean, people are more interested in what kind of benefit this application can provide you. And also the legitimacy versus trust from users are very important. Unfortunately, MOCA was not widely used in all faculties. For example, number of registered users was 6,000, which is very far less than the all students in the university. And it was mainly used in the faculties whose dean and department chair was supportive about this idea. But some deans or some department chairs did not fully understand the benefit of this smartphone app. So they don't deny, but they don't support. So they were kind of neutral. In such kind of department, it was difficult to penetrate this idea. And also, in addition to gaining grassroots trust, the clear direction from the leader turned out to be very important. And so to be honest, I have lived my life as a technical researcher, but my experience in developing and operating MOCA has taught me that the governance is a discipline for the efficient realization of public objectives. And so now, yeah, and as you know, we developed the whole system in 3 months, and technology was made, a lot of technology has made its, has contributed to reducing the deployment time. So it is very easy to deploy some idea very fast, but it is very difficult to make people, persuade people to follow this somebody's idea. And so as the cost of deployment comes down, it will be more important for engineers to understand the people and also society more deeply. Yeah, and I want to conclude this talk. Thank you very much.
Thank you for very interesting presentation, Dr. Kawahara. So if you have any question, please go to the standing microphone. And online participant, if you have your question, please write it down in the chat box in Zoom, please. Yes, please.
Thank you for your talk about your good experience, actually experienced in the COVID-19 situations. And I hear that cocoa is not so used because the cocoa consumes a lot of power batteries in their mobile phones. How about the mocha? It's used many batteries or not?
Yeah, this is very, I need more 20, 30 minutes to explain this complicated situation. But in short, of course, ENA API and this kind of contact tracing app use more energy than compared to the case when they don't use such kind of application. But actually, overhead is very low. And for people who actively use Bluetooth, it's a kind of negligible. But yeah, some cases true. People who completely may turn completely off the Bluetooth smartphone feel significant more usage on the terminal. So this may reduce the some people felt they use a lot of energy. And also, I found some models from some manufacturer actually uses a lot of energy. And so for Android, it was very tricky. And also because our specification is slightly different from the maker to maker. So it was very difficult to cope with the energy increase.
Thank you very much.
Thank you very much for nice talk. So I know the Mocha already knows that I want to ask about how to distribute the Mocha. So or how to involve the developer and how to, so maybe, so as you said, it is very hard to involve many students and ask a student to install Mocha. So the later I will talk about that, but I want to know what did you do in Tokyo University?
Yes, so this is a timeline. Just after the COVID-19 spread, we had an online discussion of how to use campus data and what to do next for the COVID and after COVID. And actually, this was a kind of open forum within the campus, but people who has a very strong interest in the emergency response are gathered. And actually, this group actively proposed a lot of ideas. So we invited those people to do the real deployment in the next phase. And so, but this group was actually first very small, only 4 or 5 people at first, but in the deployment phase, we needed more people. So we used SNS, Twitter, and so we need your help. We need to deploy thousands of sensors on campus. And if you have a free time in summer vacation season, please come and please help us deploy the beacon. And actually, you can see the 3 students in this building. Actually, they are freshmen, the first year student in the Kumabu campus. And this is the 3rd time they are allowed to enter the campus because right after the entrance of the university, university said, no, don't come to the campus. And so they are very happy they can be a part of, they can help this kind of installation and felt they are actually part of the university members.
Okay, and when you so involve those students or develop the system, so how to manage the cost?
Yeah.
So that is a big problem, I think. So after the COVID-19, so maybe Tokyo University makes some money for such a dripping, especially the university start the Zoom soon quickly, but in Kyushu University, so sorry, so they cannot decide it quickly.
Okay, so I have never mentioned about the cost, but actually the expenditure to manage the server is not very surprising amount. Like we pay like $1,000 per month to accommodate 6,000 active users, but this is a kind of expensive, but not ridiculously expensive. And in terms of application development, we had a super programmer, Professor Nishiyama,
I know.
in our group. So he wrote probably 50–60% of the code, and also we recruited the students and we paid to the students. But they were the salary was average salary was higher than the other small tasks, but still it's very much cheaper than officially made systems.
Thank you so much.
Thank you. So any other question? Okay, so almost it's time to end. So thank you for your presentation, Dr. Kawahara.
Thank you very much.